Good morning, all. The topic for today's presentation is Theories of Motivation, and it is being presented by me. My name is Jasmine Rana, and I'm a PhD scholar of clinical psychology, and my moderator is Dr. Rupal. What is motivation? It is a mechanism which ultimately influences people to act in a desired way, and it is a willingness to exert high levels of effort towards organizational goals, and it is conditioned by the effort's ability to satisfy some individual needs. Now, there are some motivational theories. The content theory of motivation, it is often described as a system of needs that motivates people's actions. For example, this includes Maslow's need of hierarchy, Elderfer's ERG theory, Mechlin's learned needs, and Herzberg's two-factor theory. And then the process theories of motivation are, which often attempt to explain how and why our motivations affect our behavior. This includes reinforcement theory, expectancy theory, equity theory, and goals. These are Maslow's hierarchy of needs. First are the psychological needs, which are air, water, food, shelter, sleep, clothing, reproduction. Second is the safety needs. For example, personal security, employment, resources, health, and property. Then comes the love and belonging, which includes friendship, intimacy, family, and sense of connection. Then is the esteem, which includes respect, self-esteem, status, recognition, strength, and freedom. Then is the self-actualization, which is desire to become the most that one can. Then Elderfer's ERG theory, it's the adaptation of Maslow's work. The three needs which are included in this theory are existence, relatedness, and growth. It is more than one need may be operative at the same time. The stiffness of higher level of needs causes lower level need desires to increase. Then comes the Herzberg's two-factor theory. It is the extrinsic or also known as the hygiene theory. It includes salary, job security, working conditions, quality of supervision, quality of interpersonal relationships. Then is the intrinsic or satisfier, which includes advancement, recognition, and responsibility. Mechlin's three needs theory. This includes need for achievement, need for power, and need for affiliation. Then comes the reinforcement theory, which is very much useful in day-to-day practices also. This is classical conditioning. Here, behaviors are learned by connecting a neutral stimulus with a positive one, versus the operant conditioning. Here, behaviors are learned in such a way as to obtain reward and avoid punishment. A positive reinforcer is a stimulus which, when added to a situation, strengthens the possibility of operant response. Then processing of using reinforcement, there are 4 steps to it. Specify the desired behavior. Make sure that you can observe or measure the behavior. Provide frequent contingent positive reinforcement and evaluate the effectiveness of the program. Now, dealing with punishment, explain what was done wrong. What is the appropriate behavior? Punish sooner than later. Try to punish in private. Balance the punishment with the nature of the offense. Then motivation equity theory. It states motivation is affected by one's perception, accurate or inaccurate, or the relative outcome, which is the rewards. One receives an input that is the efforts one exerts in comparison to others. Then comes the expectancy theory. Expectancy is the person's belief that hard work will lead to good performance. Instrumentality, the person's belief that good performance will be rewarded. And valence, the value of the individual assigns to the reward. Goal theory. According to this theory, goals are clear, specific, and challenging, and are more motivating than vague or easy goals. Then we come to the motivational enhancement theory. It is a short-term technique. It is used in substance use disorders. It focuses on helping people to feel more motivated to change their destructive or harmful behavior. It is a client-centered approach. It is non-judgmental. It strongly emphasizes individual choices. It helps foster a sense of empowerment and motivation. It integrates aspects of integrates aspects of motivational interviewing. It is based on theoretical model of change. So the first stage is pre-contemplation, where the person is not thinking of changing the behavior of potential benefits. Stage two is he started to contemplate, which is thinking of changing behavior but not yet acting on intention. Third stage is preparation, where he is ready to change behavior but he is not yet acting on it. Stage four is action, which means beginning step towards adopting the behavior, but with the risk of relapse. Stage five is maintenance. Maintaining the behavior with risk of relapse still remains. Then the techniques are, it is brief and time limited, typically lasts for 4 sessions, but can go up to 6 sessions sometimes. The first session is the rapport building and assessment. 2 to 5 sessions is motivational interviewing strategies, which is to help client gain greater awareness, build motivation, and develop a plan to change. Now, motivational interviewing, it includes express empathy, acknowledge discrepancy, avoid arguments, accept resistance, support self-efficacy. Now, when you express empathy, it is basically you are helping people to develop and express how their own behavior affects other people. Now, motivational interviewing, it is acknowledge discrepancy, which says helping people acknowledge the discrepancy between desire and reality. Motivational interviewing, point 3, avoid arguments. Here, the MET therapists do not argue with an individual about their behavior or substance use. Argumentation often triggers defensiveness and resistance to change. Gently and optimistically helping people to become more aware can make the motivation to change come from within them rather than from someone else. Then accept resistance. There would be times when the patient or the client is going to be very resistant. Here, it is very common. Instead of fighting, look for ways to diffuse the struggle. The goal is to minimize resistance, allow the individual to stay in treatment, work toward building intrinsic motivation to change. And then point 5 is support self-efficacy. Make people believe that they are capable of achieving their goals, can recognize their struggles, gain greater benefit in their own capabilities. Now, the uses of MET. It was development for the treatment of addictions. It may be useful in alcohol use disorder, bipolar, eating disorders, generalized anxiety disorders, obsessive compulsive disorders, post-traumatic stress disorders, short-term improvement in viral load in young people living with HIV, and it could also increase safe sex behavior. The benefits are, it works quickly, as we discussed earlier, time limited, 4 to 6 sessions. It reduces resistance and ambivalence since persuasion tactics are not used. It emphasizes choice. Instead of authority, it is a collaborative partnership with the therapist. The effectiveness of MET in getting substance users to begin or participate in treatment. It is less effective at getting people to actually reduce their substance abuse. Depends on nature of individual's addiction. It is most helpful in alcohol users. When combined with cognitive behavior therapy, it is found useful in marijuana addiction. This approach is less effective in nicotine, heroin, and cocaine. Now, things to consider while giving MET. It is beneficial and effective for many people, but it does not mean that it is right for everyone or for every situation. Not typically used as standalone treatment addiction, which means that pharmacological treatment will also be required. Now, it is best applied as an adjustment to cognitive behavior therapy and other therapy. Thank you. Yes, ma'am. Thank you. Yes, ma'am. So, ma'am, basically, like for Maslow's hierarchy of needs. Okay. 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 So, firstly, we come to Maslow's hierarchy of needs, which is it starts with the psychological needs. So, which are, as we discussed, air, water, food, shelter, which are the basic needs. Physiological, I'm so sorry. So, physiological needs, which is air, water, food, shelter, sleep, clothing, and reproduction. So, these are the basic needs which every individual needs. And then come the safety needs. So, safety needs are going to be personal security, employment, resources, health, and property. And then the love and belonging. So, as we all know, these needs are required by, look, these are the needs. So, these are like basic requirement for every individual. And yes, ma'am. Then come the Elderfer's ERG theory, which is it is again the adaptation of Maslow's work, and there are three needs which he states that are needed for the existence, needed for every human being, which includes existence, relatedness, and growth. Existence के लिए again whatever the physiological needs were there, and relatedness, which again includes the belonging and lovingness from the others, and growth, which is uh, you can say a career growth for the financial requirements. And it is the Herzberg's two-factor theory states that if we come to our professional life, then there has to be a good job security and a satisfactory salary also. Otherwise, a person will not get the motivation to work. And then the working conditions should also, to some extent, should be favorable. Then quality of supervision. Now the supervisor here should also make a very comfortable environment for the employee. Otherwise, if the salary is good or there is job security and the supervision, the quality of supervision is not very great, it is not going to give a very comfortable or a very good mindset to the employee. Then the quality of interpersonal relationships. As we all know, there has to be a very good quality of interpersonal relationships wherever we go to work or learn. Yes. Yes. Otherwise, if that is missing, again, the motivation will not be. And the motivators are advancement and recognition and responsibility. So when there is advancement, obviously there is going to be that is going to be a motivating factor. And recognition, for example, if you are recognized for the work that you do, you're praised for the work that you do, it is definitely going to act as a motivation for you. And responsibility also. So if I say, like, if I give an example that you go to work, but there you're not given any responsibility, there'll be nothing to look forward to. Even if there is a good salary, so you will start, taking everything for granted. So a good responsibility is also good motivator. Again, this is the Mechlin's needs for theory, three needs of theory. Need for achievement. We all want to achieve something in our life on day-to-day basis also, or we have a long time set goals. And then need for power. We all know that as human beings, we all want to have a need of power. There has, like, we all, somewhere in some point of life or even day-to-day life, we always enjoy, we are given a certain power that is also that gives us more motivation. And need for affiliation. Now, whatever, even if we have achieved something or we have the power, there we definitely want somebody to give us the affiliation for the work that we are doing or for the achievements that we have gained in our life so far. So this is the reinforcement theory, which is classical conditioning. Here, behaviors are learned by connecting a neutral stimulus with a positive one. Okay, ma'am. So it versus the operant conditioning, where the behaviors are learned in such a way to obtain rewards or to avoid punishments. Okay, ma'am. Okay, ma'am. Ma'am, are you moving forward? So processing for using reinforcement. So specify the desired behavior. So you have to tell the person in detail what kind of behavior you are expecting, and then make sure that you can observe or measure the behavior, whether it's a good behavior, to what extent it was satisfactory or to what extent it wasn't. Then provide a frequent contingent positive reinforcement. So there has to be a frequent there is a frequent requirement for the positive reinforcement, that for example, if the child has done something good, so you can uh, there should be a frequent positive reinforcement to the child, which gives them motivation to perform better. And then evaluate the effectiveness of the, maybe you can note it down, or in your own mind you can find out how effective is the program. And then dealing with punishment, so it's very important to tell what was done wrong and what is the appropriate behavior. By not just telling what was wrong, it is equally important to tell what was the appropriate behavior or what was required, and punish sooner than later. Later punish, sorry. Yes, ma'am. But punishment should be sooner than later. Otherwise, it is going to lose its, yes, effect, and also it can harm the person. And try to punish in private, so that the child or the person whomsoever you are punishing does not feel humiliated in front of others. That is going to bring his morale down. And then balance the punishment with the nature of the offense. For example, a child has stolen a pencil and is stealing it repeatedly. You cannot just punish him like very hard by not giving him food or something like that. So the uh, punishment should match with the, or balance with the nature of the offense. Then equity theory, motivation is affected by one's perception, accurate or inaccurate, of relative outcome one receives and inputs one exerts in comparison to others. So it is, motivation is affected by one's perception. So whether it's accurate or inaccurate, and of the relative outcome. So with the one's perception is so motivation is affected by one's perceptions and with the relative outcome in comparison to the others. I'm sorry, ma'am, I'm not able to explain this one. So expectancy theory, it's persons believe that hard work will lead to good performance, which is brought into our system from a very young age, that it is a belief that we are raised with, that hard work is going to lead to good performances. And then the persons believe that good performance will be rewarded. As we tell our children that if you perform well, you will be rewarded with this, or if you perform well in exams, you will be rewarded with this. And the value of individual assigns to the reward. Again, the value of whatever the individual has been assigned, should be, again, with the balance, it should balance with the reward. So according to this goal theory, goals that are clear, specific, and challenging are more motivating than easy goals. So if the goals are very specific and the goals are clear and sometimes challenging, challenging goals give us more motivation than any vague goal or any easy goals. And then this is the theory. Okay.